Street-level data and information have to be in real time if the conversations of a return to work are to be achievable and not increase the pandemic. Allowing people to return among the masses to work without this is suicide, murder, whatever statement you wish to use. Nonsensical, and we all know it. We are not marketing and selling a solution. We, Entrical and our sister companies, know that the ability to collect relevant data, information, and disseminate in real time is the only answer. If it had not been for Edison and Tesla researching, designing, failing, and telling the world they had a new way to give light instead of gaslight, you today would not be able to read, see, or hear our words. So do not brush to one side and ignore and think it is just a company cashing in on a dire situation. What is necessary to be able to contact tracing was not created over the weekend. It has been in effect for the last decade plus by us. Our base activity mature solution is Platform 11, which has been in use with law enforcement and public safety for over 7 years. A secure solution in real-time data, information, notes, photographs, video, which shared with cross-agency departments at the speed of life. The Platform 11 COVID response and contact tracing module is in operation in Louisiana, making that vital, timely difference. Real-time data is more than necessary as time brings complacency with aggressive vulnerability. We cannot drop our guard. The simple steps. The patient either is presented at a hospital, doctor's office, or a drive-through testing facility. Testing and data entered via tablet, including addresses, others in the vehicle, those in the household, place of work, etc. Selfie of occupants. All detail is now live in Platform 11 COVID response and contact tracing module. Secure and administratively controlled.
This is an overview of the COVID response application. You'll begin by logging into the application, and it'll take you to the dashboard. This is where you'll see a list of all the different patients that you have scanned into the system and waiting for results either to come back or to track the results. You'll begin by creating a new patient where you can put the parish or county, the patient's name, date of birth, age, race, gender, mailing address, city, state, zip, phone, the date and time that the specimen was collected, the primary doctor, which is a drop down that you can choose from, or you can add a new doctor. And at this point, you would go ahead and create the file. Once the file is created, it'll be on your dashboard here with the results pending. Once the results come in, you can go and edit it down to the results section, put the date that you received the results, the result, whether it's positive, negative, rejected, declined, or still pending, communicated it. If you do get the results, you can say if you communicated it to the patient or to the primary caregiver, and the date and time that it was communicated with any results, and you can go ahead and save that record. After this point, you've got the ability to go ahead and filter and run reports by these different methods to go ahead and export it and then give it to your primary caregivers to go ahead and contact the patients with the results and do full tracking of how many cases you've had and by different results as well to report and keep track of it. So that's a high level of the COVID response application.
The information is available for all reports at the speed of life, bringing an ability for the next phase of knowing it is clear and can assist in the antibody capability to increase the potential for a vaccine, all encompassed. Platform 11 COVID response and contact tracing module, a global solution. Across all borders, available now. Implementation completed via secure connections, active with full support. These are our Entrical locations. Call us now.